Hi everyone, welcome back to the HMH Agile series. I'm Beth Gregg from the HMH Agile Institute, and today I'm here with Lama and Victor from our institute. Hi guys, welcome back.
Thank you.
Today we're going to talk about the ambulatory assessment and how you both applied an agile mindset to the work being done. Let's start first with what is the ambulatory assessment and why you thought about this as an approach.
As we take stock at our ambulatory network and how large and complex it is, we have over 450 practices throughout the state of New Jersey. We're actually the second largest entity within HMH. The practices are varied in sizes, over 7,000 physicians and 500 patient care locations with 2.1 million outpatient visits per year. We thought it was important to do a true assessment and evaluation of where we were in our journey through our practices so we can continue to look forward in the development of some plan that's more strategic in looking at our growth.
That does sound complex. Thousands of providers, team members, locations. Lama, can you talk to us a little bit about how you engaged all of these stakeholders?
One thing we took as a first step is we wanted to make sure we not lead with any solution. As Victor mentioned, our system is complex, different people coming from different culture, different office and ambulatory background. So we needed to kind of engage everyone. And our ambulatory assessment was really for the safety of our patients and the safety of our team member. So it does not only involve our clinician and physician and quality personnel, but it involves patient from safety, from security, from HR, and many other components that are really related to the day-to-day operation of the ambulatory space. So we first started by identifying the leaders in all of these ambulatory space division that needs to be present, and we need to hear from them. And we came together and did kind of what we call an innovation forum. So we really tried to build first the demand from them into what do they need? Do they really need an ambulatory assessment, or is there any other solution that they would suggest? So we brought all of these together for a couple of sessions with this kind of a specific agenda, but is open-ended agenda. I kind of really want to hear from them. What do they want to know? And in those sessions, we really were able to hear them saying that they wanted a more standardized approach where they can do some evidence-based solution assessment, but at the same time being a little bit flexible into assessing some of their needs. And really, this is what we did. We went and looked for evidence-based solution for what could be a good encompassing ambulatory assessment. We brought the couple of solutions back to them, and they chose one, but we really kept it open by doing what we call relay sprint. So what we were able to do is to send each of the division or the leaders the questions that it's pertaining to their part, and then ask them if they need to change anything within certain boundary to make sure the tests or the assessment still standardized. So they were able to really give their input about things that make sense to them and things that does not make sense to Hackensack Meridian Health. And this is where we were able to get all of these stakeholders together and be able to engage them into starting and doing this work.
Thanks, Lama. So just to summarize, it sounds like you did some network mapping to identify who you wanted to be at the table, given the complexity that Victor so nicely outlined for us earlier in the discussion of our ambulatory arena at HMH. Once you understood who needed to be there, you brought them together to come up with your core essentials of what an assessment should include, still allowing for some localization and flexibility based on what they felt they needed. So now that you've decided on the assessment together as your team, you co-designed those core essentials. Can you tell us a little bit about how you sprinted and came up with termination plans around the engagement with this assessment?
We kind of looked at many or in general ambulatory assessment or type of these assessments that are done in these type of situation. And so what is kind of an average engagement of percentage of engagement in those assessments? We looked at our average engagement with the HMH. This is a survey at the end. It's an anonymous survey. So we really need to take into consideration how our staff and our team member accept and respond to these type of survey. And from these, we came up with a termination plan, kind of by a certain date, which we agreed on with the leadership team, that if we don't have 25% engagement, meaning response to the survey from all of our ambulatory clinics, including all of our team member, we will terminate. And we really gave one person, which was Victor, the power of kind of saying, if we don't reach those numbers by the date we all agreed on, you can tell us stop, and then we need to kind of pivot, meaning that we need to understand what's going on, why this is not happening, and then do we need to change the ambulatory assessment or change our approach? And what was crucially needed to be able to do that is the dashboarding. We really was able, from this ambulatory assessment we chose, that we had a dashboard that we could look at that was updated twice a week, where we could look at the percentage of engagement, which region has more or less engagement, which team member, for example, physician versus medical assistant versus frontline, etc., have less or more engagement. So we were really, and which specialty have more or less. So throughout the time before that termination plan deadline, we were able to discuss in our weekly huddle, this specialty in this region is not engaging at all. They have like less than 5%. Can we reach to their either clinic supervisor or reach to the chair or reach a specific person to try to enhance that engagement? And this really was very, very essential. So direct feedback loops, dashboarding was very critical for our success.
Keeping in mind, termination and evaluation plan is part of the planning phase of the implementation cycle and Agile implementation. And that is where the stakeholders outline what success looks like. I think many of us in quality are very used to setting up what success looks like, right? Those lagging measures, the things that take a while to change versus the leading measures or process measures that we're monitoring our daily activities around in order to achieve that minimal viable goal that we all agree on. But the termination plan is unique. And so that is where we take a look at what failure looks like. This makes sure that we don't fall in love with our solution as a team or individually. And it also takes away any subjectivity. You talked about Victor having the assignment of making the call, right? So Victor knew what the criteria were, and he was the individual given responsibility to make the call around that termination plan. So for those of us who don't regularly use these words in our day-to-day, sometimes important to take a step back and talk through what that really means. And it sounds like it set you up for success in your project, recognizing that you were using the survey response rate, and you also broke it down by role so that you understood who you needed to connect back with, and maybe taking away some of those pearls from your network mapping where you found messengers with influence so that you could reach out to them to ask what's going on with the low response rate, or hey, what can we learn from your successes if your response rate's really high, right? And using that information to continue to scale the success of the survey. So now that we hear about the complexities around our ambulatory arena in our organization, we heard that you needed to engage the stakeholders that you identified through network mapping. We talked about setting up a sprint evaluation termination plan around the engagement with the assessment you all co-designed as your core essentials. What's next, Victor? Can you take us through what your plans are for the future?
Absolutely, where the rubber hits the road, right? So now that we've completed this assessment, gathered a plethora of fantastic information, it's important to do a few things, right? We need to connect back to those stakeholders and share lessons learned from the assessment, right? What are the themes? What are we hearing from our frontline team members, from our physicians and our practice leaders, and then be able to take that and those lessons learned and what they've shared with us in order to develop specific sprints to close gaps where gaps have been identified, right? That allows us to not only connect back and feedback information to the leaders, to be able to move the agenda forward, but also to make sure that team members see that their responses to these assessments don't go unheard, right? If they brought up an issue, we're going to close that issue and close that problem for them to move forward. And ultimately is to develop a plan that continues to move our ambulatory space forward, right? And to make sure that we position HMH to continue to be a leader in ambulatory care throughout the state of New Jersey and across the nation.
Thank you, Victor. That's really impressive. And to engage thousands of team members, providers, nurses, care technicians across hundreds of locations in our state. Congratulations to you both for the incredible work you've done and for the bright future ahead to keep HMH at the forefront of healthcare transformation, not only in our acute care arena, but in our ambulatory spaces as well. Any other final parting comments from either one of you?
I would just say that really we're very, very thankful to all the leaders across all of the department for us to be able to do that for the first time this past year. Really, they were incredible by their engagement, their response, in terms of either adjusting some of the questions, tell us what's going on in their departments for us really to be able to build that and move this ambulatory assessment forwards, and therefore for their feedback, even in now starting the gap, after the gap analysis and starting the sprints to change things. They are very crucial and will continue to be very crucial in their engagement and sustained demand.
Thank you, Lama. It's really powerful to hear that all of these leaders and team members alike have had a voice in this process and now will continue to have a platform to share that open, honest, actionable feedback with us as a team. Victor, any other parting words?
No, I couldn't have put it any better than Lama did. The ambulatory leaders and team members are fantastic, and they gave themselves to this assessment, to this commitment to continue to move forward and to grow and to be better. And that's all we could ask for. So I'm very excited about what the future holds for the ambulatory space at HMH.
Amazing. A true testament to everyone's dedication for safety and shared vision for excellence in the organization. Well, thank you both for joining me today. Thank you to our listeners for checking in. If you want to learn more about how Agile can make a difference for you in your workflow, please check in with us at the office of the CQO at hmhn.org. Keep your eyes and ears peeled for future episodes.